Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you are watching Dr. KK's Med Talks, Mondays with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 853वां 853rd एपिसोड है. Let's have the headlines for today. Amidst a rise in corona cases, COVID के cases बढ़ने शुरू हो गए हैं. The health department has instructed all private pathology and diagnostic centers to conduct COVID tests only at government prescribed rates. A recent review of international publications, ये publications देखेंगे, research देखी गई, it has revealed that even mild COVID-19 infection can cause a decline in brain size. तब भी मैं सोचूं मेरी याददाश्त क्यों कम हो रही है. A decline in brain size of up to 2%. तो COVID के बाद actually brain size में भी फर्क पड़ता है. And the Rajasthan state government has proposed to the center कि जो rates of treatment of diseases हैं, they should be kept under the Clinical Establishment Act. GSK's novel antibiotic drug is under trial now for the treatment of antibiotic-resistant UTI, urinary tract infection. And there is increased awareness amongst the population, ये अच्छी चीज है. And heart attack के लिए एक test होता है troponin. So the testing rates have gone up, and that is a good thing because you can detect heart attacks in time, and then you can treat them in time. So with this, let's go to our topic for today. अरे वाह, ये तो बड़ा मोटिवेशनल टॉपिक है. मोटिवेशन इन डेली लाइफ, ओके, डेली प्रैक्टिस एंड फ्रॉम डेली लाइफ फ्रॉम थ्योरी टू प्रैक्टिस. ये तो बहुत ही अच्छी चीज है. तो हम जानेंगे मोटिवेशन की थ्योरीज क्या होती हैं और ये जानेंगे उन्हें प्रैक्टिस में कैसे लाएं. एंड फॉर दिस वी हैव स्पेशल गेस्ट विद अस, समवन हु इज एन एक्सपर्ट इन मोटिवेशन, डॉक्टर शीला डैंग. वार्म वेलकम मैडम.
Hello.
Hi Dr. Sheila, and welcome back to the show.
Thank you, Sanjay sir. This is again a pleasure to be here.
Dr. Sheila Dang is a Mumbai-based psychologist. She is founder director of the Sheila Dang Mental Health Care Center Private Limited. A trained psychotherapist. Madam से ये भी पूछेंगे psychotherapy क्या होता है. She helps in various mental disorders including trauma, and she helps patients overcome their stress, which might be because of abuse, due to other issues. And she strongly believes in getting to the root of the problem to help patients seek better solutions and treatments. So, Madam, warm welcome. Lots of people have logged in. Dr. Vipin Bandula hai, he is a civil surgeon, Kangra district, Himachal Pradesh. Chirag Kaushik ji bhi logged in hai, thanking you for all your support and what you've taught us. And Kaladia Creation ji, diabetes का सवाल एक बार बाद में लेते हैं. आज का टॉपिक है motivation, but do listen in to us because we learn from Dr. Sheila how to motivate पापा, कि आपके पापा को हम motivate कैसे करें कि अपनी शुगर का इलाज ठीक रखें. Vinayak Sharma ji bhi hai, yeah, and Dr. Ramesh Pal Singh Pawar, sir is a motivating factor for all of us. He is 72 years young. He's a pediatrician from UP, from Saharanpur.
I'm so lucky that he's here today.
And Swapna Jain ji is a very well-known voice for patient advocacy, for motivating people to lose weight. So the question coming from all of them is, what is motivation? Simple sa lafaz hai, ek chota sa ye shabd hai, it's a small word, but it carries a lot of weight. So what does motivation mean?
So, well, Sanjay sir, motivation is nothing but it's the main factor that leads us to our life, you know. It's the behavior. हमारी behavior क्या है? हम कैसे आगे चीजों को देखते हैं? Psychosocial factors में हो गया या daily life में हम कैसे अपनी life को देखते हैं? Also, motivation means that you know how much you provide. आपकी जो needs है और आपकी जो wants है, क्या आपको उसके बीच के अंतर पता है कि नहीं है? I think that is the most important factor that one needs to know when they need to be motivated for anything. Also, it is a drive to do something. हमें आगे कुछ करने के लिए उत्साह रहना बहुत जरूरी है. तो व्हाट इज द ड्राइव दैट वी हैव? इंटरनल ड्राइव क्या है, एक्सटर्नल फैक्टर्स क्या है जो हमारे ड्राइव को पुश करती है? I think these are very important factors, and it's in whole, motivation is just our behavior, how we can take forward to continue with our certain tasks or goals that we have in our life.
Hmm. So motivation is a drive, and it's something that helps us move towards whatever we are aiming for. So,
Yes.
would this be correct, Dr. Sheila? Okay, let's say I'm aiming for good health. That's not enough until I have motivation to achieve the good health.
True, to some extent it is true, Sanjay sir, but also it is very important that what are the factors that you're looking forward to, have a good life? क्या आपकी वो habit है? What is your behavior towards having a good life? If you are not having your routine, या आपकी अगर daily life में वो habit ही formed नहीं है, you will not be motivated. There is no drive, there is no motivation if you're not pushing yourself to do anything. तो habit आपकी जो है, that, and also motivation will come with a habit change, and it needs consistency, which
So,
is very important.
so a drive and a habit, something which keeps on pushing you. And Dr. Sheila also said it can be internal or it can be external. So we'll talk about that. Also, Dr. Sheila, greetings to you from Dr. Pradeep Rawal from Ujjain in Madhya Pradesh, and from Dr.
Hello,
Noor
sir.
Ahmed Danish, yeah, from Kabul in Afghanistan. So welcome, Dr. Danish. Tanisha Arora ji bhi aapko namaskar kar rahi hain. So you've spoken about motivation and you've given different words for it, different types of
Right,
explanation. हिंदी
right.
में से प्रेरणा कह सकते हैं.
Ji,
Yeah. So,
yes,
and you also used internal and external. So,
ji.
are these concepts used in psychology? Internal locus of control and external locus of control.
Right. Also in psychology, we call this as intrinsic and extrinsic motivation.
Hmm.
So just to make it a little simple for a lot of audience that we have today, intrinsic will always come from within. Internally, like, you have a drive to do something internally. Like, mujhe ye, for example, if you have some task given to you by your office and you will feel like doing it if you have the will to do it, externally you would probably do it because you have to do it because your boss has said it. So it's a lot of difference. It's a very thin line, एक बहुत ही पतली line होती है इस दोनों के बीच में. But if you get to know this very properly, you will understand how to motivate yourself.
So, intrinsic comes from inside, and public health, mein, community medicine, mein, the word you will be used will be internal locus of control, which
Right.
means the person himself or herself will take charge of whatever is to be done. They will not depend upon the doctor or upon the politician or upon the policy maker to take care of themselves. They'll take charge, whether
True.
for the better or for the worse. ऐसे ही
True.
विनय गुप्ता जी भी हैं हमारे साथ, करण राजपूत जी भी हैं, and almost everybody who is logged in today is somebody who follows the internal locus of control. Internally, you are motivated to listen to KK Med Talks and to listen to Dr. Sheila Dang. There is no external pressure. ऐसे ही आपने
Right.
बात की extrinsic की. So extrinsic control है like the boss is pushing you. And in community medicine, we'll use the word external locus of control, which means if there is somebody else controlling you. जैसे मैं gym जाता हूँ, and one of my gym mates, his name is Gagan Gupta. So he's appearing for the CA exams also next month. So please join me in wishing best of luck to him. So and now Gagan Gupta takes care of me. So Gagan will say, "Sir, आप दो सेट फलानी एक्सरसाइज के करो. आप पिछले हफ्ते से आपने चेस्ट नहीं मारी, तो अब आप दो एक्स्ट्रा सेट्स आप चेस्ट के जरूर करके जाना." And I'm very happy because Gagan is taking care of me. That's an external locus of control.
Right.
But now
Right.
Gagan is going to go on chutti because he has his CA exams, like I said. So
Right.
then I think I will have to create an internal locus until Gagan
Yes.
helps me and he leaves a 20-day homework list for me. कि sir Monday ये करोगे, Tuesday वो करोगे.
No,
तो
very well said, Sanjay sir. This is absolutely right the way you have explained it. क्या होता है ना कि हमारी जो ड्राइव होती है वो बेस्ड ऑन नीड्स होती है एंड बिहेवियर होता है. Also, we cannot ignore the conditioning that we have grown up with. हमारी एक particular conditioning होती है. हम बहुत comfort zone में बैठ जाते हैं कि this is my comfort zone. अभी इससे बाहर क्यों निकलना है? या probably sometimes you're not even aware that you have settled for your comfort zone. So motivation will be a little low when you settle for your comfort zone. If you are out, आप थोड़े से अपने reinforce करते हो अपनी behavior को, so it becomes very helpful that you can balance your event situations, या आपकी जो cognitions है, आपकी सोच है, या आपके actions है, behavior है, वो balance रहेगी.
एंड विनय गुप्ता जी, रत्नेश जैन जी, अनामिका नु, ऑल ग्रीटिंग यू. एक क्वेश्चन आ रहा है विनय गुप्ता जी से, बट लेट्स
जी.
डिस्कस समथिंग बिफोर वी कम टू दैट. हिज क्वेश्चन इज, व्हाट आर द फैक्टर्स इन्फ्लुएंसिंग मोटिवेशन? So,
So,
Vinay Gupta
yeah,
ji, yeah, give us a few minutes to answer that directly. We are
yes.
talking about a classification of motivation, जैसे intrinsic, extrinsic आ गया, external, internal locus of control आ गया. अब डॉक्टर शीला ने ऐड किया, you cannot ignore the conditioning, जो आपकी past history है, that you cannot ignore. Now, she also used the word comfort zone. अब comfort zone से निकलने के लिए एक motivation चाहिए, मगर एक destination भी तो चाहिए. तो मंजिल अपनी जगह, रास्ता अपनी जगह, और जो मोटिवेशन है वो हम सफर है. Would we be correct in saying that the motivation, wherever it comes from, whatever type it is a humsafar or is a travel companion to help you enjoy the journey to wherever you're going to?
Yes, very true, Sanjay sir. This is absolutely right. But also at the same time, जरूरी नहीं है that वो you are just sailing up. हो सकता है कभी you are feeling a
Yep.
little low, you're not motivated. आप अपने आप को allow करो to feel that certain emotions. You don't always have to push to a level or a bar to be in a pressure and just to prove something. हो सकता है कभी ऊपर नीचे हो जाए, but as long as you change your habits, you change your behavior, as long as you're trying to strive to be in a certain way, I think that's more than enough.
So, two things coming out from what ma'am has said. Number one, motivational fluidity. Motivation is never going to be static. It's never going to remain the same throughout. There will be ups and downs. Now, अगर झटके लगे, now that is a separate matter. But थोड़ा बहुत ups and downs, वो तो जब नदी में पानी बहता है तो भी होता है, लाइफ में होता है. So that is called motivational fluidity. That's one thing that is coming out. दूसरा जो मैडम ने कहा, which is even more important, that is, I think, what she is saying is acceptance of motivational fluidity. आप इसे accept कर लें. अगर कोई नेगेटिव या demoralizing कोई emotions आ रही हैं, you don't have to suppress them. First of all, you accept them, and then of course you'll move ahead. गाड़ी तो चलती रहेगी लाइफ की, but you accept it as part and parcel of life. मैम, अब हमने बात की मोटिवेशनल फ्लूइडिटी की, एंड सडनली द वर्ड नेगेटिव हैज कम इन. तो टाइप्स ऑफ मोटिवेशन, ऐसा कुछ है क्या? पॉजिटिव मोटिवेशन, नेगेटिव मोटिवेशन, अ पुल वर्सेस अ पुश. हाउ डू वी क्लासिफाई दिस इन साइकोलॉजी?
Yes. So we have something called as behavior modification, if I have to give you that picture. So behavior modification may, you can reinforce certain behaviors in a positive and a negative aspects. So जैसे एक behavior है आपका, you want to change a behavior. For example, एक डिजायरेबल बिहेवियर होगा और एक अनडिजायरेबल बिहेवियर होगा. ना इफ यू आर टॉकिंग अबाउट डिजायरेबल बिहेवियर, यू विल बी पॉजिटिवली रीइंफोर्सिंग इट, क्योंकि आपकी डिजायर्स है उस चीज में, यू वांट टू डू इट. बट हो सकता है इवन इन डिजायरेबल बिहेवियर यू कैन हैव नेगेटिव रीइंफोर्समेंट्स. लाइक फॉर एग्जांपल, वेरी सिंपल एग्जांपल, एक बच्चा अगर बोलता है कि आई डोंट वांट टू स्टडी, या if an adult is saying I don't want to go to the gym, or I can't diet. So negative enforcements में हम क्या करते हैं, we have certain withdrawals of certain activity or certain food or something. Positive reinforcement, we are adding something. Negative में हम minus कर रहे हैं, positive में हम plus कर देते हैं. And when we are having undesirable motivations and reinforcement techniques, इसमें हम punishments जैसे we withdraw something that you like doing. But ये सिर्फ mostly हम सिर्फ बच्चों के साथ नहीं, we can do it with adults as well. Like अगर if you don't go to the gym, and then we show them the undesirable changes, ways of changing that certain behavior. So positive reinforcement will be adding, negative will be minusing something that you would, like मुझे अगर खाना खाना पसंद है बहुत ही, so I will minus that. इसका मतलब ये नहीं that I don't eat at all, but I'm going to minus certain things that I'm not supposed to eat.
So positive and negative reinforcement for
Yes.
positive and negative behaviors. But ये कौन decide करता है कि एक particular चीज desirable है कि नहीं है? Let me take an example. There may be one person, there may be one individual who says, I do not want to drink alcohol because it is harmful for my liver. उसके
True.
लिए alcohol पीना is undesirable. On the other hand, there may be another person who says, I really wish there were a medicine to help me handle more alcohol without passing out, without feeling drunk, because that is part and parcel of my social life. I need to go to parties where I need to be able to hold my alcohol. अब चीज तो वही है, कोई उसको पॉजिटिव ले रहा है, कोई नेगेटिवली ले रहा है. तो यहाँ पे क्या कंफ्यूजन आता है, या देयर इज नो कंफ्यूजन एट ऑल? लोकस ऑफ कंट्रोल, desirability, who decides what is good, what is bad?
I think it is us. Basically, it is your own self who's going to decide that. There's no one else who's going to come and decide that for you. Of course, there are professional helps that can be taken. Like, for example, if you're talking about alcohol, now, if it's the party, the alcohol is not the problem. The party would be the problem over here, which means you are telling that मुझे पार्टी में जाना है and I have to be socially very active, so I need to drink, which means you need to cut down on your parties for a while in order to have a little bit of motivation to not drink and get into a different habit, form a different habit. So probably if the person is partying every day, and aisa bhi nahi hai ki you stop it completely, because that's not going to help and that may lead into relapses. You got to take baby steps. So if a person is partying maybe 4 times in a week, in a month, you can cut down to 2. So that's how you will change your behavior step by step. And it is you yourself that decides what you want. जब से वो अगर वो अंदर से ही नहीं आएगा that you want to change, you want to motivate yourself, it's not going to be otherwise there in your life.
So the person, the individual himself or herself will decide. ये एक बेसिक ट्रूथ है, या बेसिक फाउंडेशन है मोटिवेशन की. एक और थ्योरी है मोटिवेशन की which talks about need for achievement versus fear of failure. तो जैसे कोई बच्चा है जिसके 40% आ रहे हैं स्कूल में एग्जाम्स में, उसको आप बोलो बेटे खूब पढ़ाई करो तुम्हें डिस्टिंक्शन मिलेगी, तो ही विल लाफ एट यू. इट्स नॉट गोइंग टू बी अ गुड मोटिवेशनल टूल फॉर हिम. देयर इज नो नीड फॉर अचीवमेंट, बट फियर ऑफ फेलियर इज देयर. बेटे कोई पढ़ लिख ले, नहीं तो फेल हो जाएगा, दोबारा फिर 9th क्लास में बैठना पड़ेगा, और तुम्हारी जो गर्लफ्रेंड है वो तो क्लास 10 में चल जाएगी, फिर मत कहना. सो
Right.
बट ऑन द अदर हैंड, somebody who is scoring 94%, you tell that patient नहीं पढ़ोगे तो फेल हो जाओगे, that person will also going to laugh. So how does this work in health? How can we use this very simple, binary, positive versus negative, fear of failure versus need for achievement? How can we use this tool in practice to help ourselves become better people?
आई थिंक फर्स्ट ऑफ ऑल संजय सर, इट्स वेरी इंपॉर्टेंट कि आपकी कंडीशनिंग कैसे हुई है. मोस्ट ऑफ द टाइम अ मोटिवेशनल ड्राइव और द पुश, द रिक्वायरमेंट फॉर नीड और वांट इज कमिंग फ्रॉम द कंडीशनिंग दैट वी हैव ग्रोन अप विद. बेसिकली अगर आप बोल रहे हो कि मुझे ये नंबर लाना है, या चाइल्ड नीड्स टू गेट द स्पेसिफिक नंबर विच इज कमिंग फ्रॉम अ पुश फ्रॉम द पेरेंट, यू नो और शायद कहीं ना कहीं उनकी कंडीशनिंग भी वैसी ही हुई है. आई गेस फर्स्ट एंड फॉरमोस्ट व्हाट वी नीड टू चेंज इज द कंडीशनिंग एंड द एनवायरनमेंट, that the child doesn't feel that the numbers are going to define them as a human or as a person, which is very important, firstly. Second, the home environment shapes the initial constellations of a child. So motivation to wahi se hi hogi, number se to bilkul nahi aati hai. Number would be like a secondary factor for the child. Now, a child, raised in a home that nurtures with a lot of self-worth, competency, या autonomy ho gaya, या self-efficacy ho gaya, which will always be a drive for the child to be motivated enough already to be ahead in life, regardless of what the numbers are. And the difference, if the parents can know first, मैं हमेशा ये कहती हूँ कि when any child is brought to me, I say the parents need to first be in counseling, because they need to understand what is the need difference between need and want. If that is what is worked upon, I guess the motivation factor also will be worked upon very, very effectively.
ओके, सो दैट्स वेरी इंपॉर्टेंट. जो नंबर्स हैं, अकेला नंबर ही पूरी स्टोरी नहीं है मोटिवेशन का.
Yes.
It's just part of the story. Maybe it's like a milestone.
यस, अगर बच्चे की सेल्फ एस्टीम सेल्फ बिलीफ ही डाउन है तो नंबर्स आएंगे ही कैसे? या हाउ इज द चाइल्ड गोइंग टू, इफ नॉट numbers, how is the child going to perform in the first place? If the child has to perform, now performance doesn't just come in studies, it comes in behavior, it comes in sports, it comes in leadership qualities, behavior, mannerism and everything. लेकिन अगर सेल्फ एस्टीम सेल्फ बिलीफ ही कंडीशनिंग से ही अगर लो रही है, how is the child going to be motivated? Likewise for us as well, adults also. If our conditioning is done in a certain way, or we are pushed in a certain way, I guess the self-esteem, self-belief, efficacy is just going to be in place, and we are going to be motivated enough, knowing the fact कि हमारी needs क्या है, हमारी wants क्या है.
बिमला
you know
कपूर जी।
I'm sorry to cut you, sir, but it's a very small example. I may want an iPhone, but I don't need an iPhone.
हम्म।
It's very
तनीषा अरोड़ा जी and Kedar Joshi ji कह रहे हैं that's very insightful. Bimla Kapoor ji also joining in. You've answered Neena Sablok ji's question, role of motivation in parenting. So what I'm learning from Dr. Sheila is don't focus on the number. जैसे हमें लेट अस से हमें गोल्ड मेडल लेके आना है ओलंपिक्स में, या हमें क्लास 10 में पास होना है. सो दीज आर गोल्स सर्टनली. मगर अगर अगर आप उसी को ही अपना सेंटर ऑफ ग्रेविटी बना लेंगे, यू नो केंद्र का बिंदु बना लेंगे, इफ यू जस्ट फोकस ऑन दैट देन यू आर नॉट गोइंग टू रीच फार. So what madam is saying is, of course there's an outcome finally that is involved. The outcome might be getting more marks, it might be stopping alcohol, but focus on the process. And then even digging deeper, she says, ठीक है, process है, there are steps to it, but before that you need self esteem, self confidence, you need conditioning. So ma'am, you've used the word conditioning so many times today,
yes.
which means it must be an important word. So what is conditioning?
It's very very important. Conditioning is how we are raised up. हमारा environment क्या रहा है while we were raised up, psychosocial factors क्या है, genetically influence क्या है, and it starts from a very base level, around when we are 3-4 years old. Conditioning होती है हमारी. हम कैसे सोचते, how we view the world outside. Our parents are always correcting us while growing up. ऐसे नहीं करना है, वैसे नहीं करना है, which is of course needed, and it's a guidance for us to be a better person. तो वो कंडीशनिंग कैसी है? जब हम स्कूल में जाते हैं तो हमारी कंडीशनिंग्स आर डन इन द स्कूल बाय आवर टीचर्स और our other people around us. That conditioning really is so important, but I say that it starts from home. It starts how your environment is. आप कैसे सोचते हो, आप अपने बच्चों को कैसे करेक्ट करते हो? Are you teaching your child to do something that आपकी needs or wants complete नहीं हुई, या your desires, and then you're inflicting it on your child? Or is it that you're letting your child do what it wants to do? Number लाना गलत नहीं है. We all want numbers, as humans. But in order to achieve those numbers, क्या आपके एटीट्यूड में मोटिवेशन है? क्या आपकी कॉम्पिटेंस में मोटिवेशन है? क्या आपकी अचीवमेंट गोल्स है? And that comes with conditioning, how you condition the child and how we are conditioning ourselves to grow.
सो कंडीशनिंग हो गया जो हमें वातावरण मिलता है बचपन में, एंड इट्स नॉट जस्ट
Yes.
द फिजिकल वातावरण और द फिजिकल एनवायरनमेंट, इट इज आल्सो द सोशल
Social,
एनवायरनमेंट,
mental, yes, yes, yes.
साइको सोशल एनवायरनमेंट एंड फिजिकल ऑल्सो. तो अब मैडम सपोज कोई कहता है जी, आई हैड अ वेरी डिस्टर्ब चाइल्डहुड, आई वाज अब्यूज्ड, आई केम फ्रॉम अ ब्रोकन होम, or I came from a home there was a lot of resource crunch. It was resource challenge. So I was
Right.
conditioned in such a way. Now I am the CEO of a multinational company. Right now there is no resource crunch. I
Hmm.
studied in a Hindi medium or in a vernacular medium school. Now I speak in English. I think in English also now. Yet
Right.
sometimes I'm not able to let go of my childhood experiences. So is there something known as deconditioning or reconditioning also?
Of course, there is something known as reconditioning, and the adult person may have moved on in life, लेकिन कहीं ना कहीं, behind your subconsciously, the abuse or maybe the trauma, it is still there. Because our body, there's this amazing book, The Body Keeps the Scores. If there is any sort of trauma or any sort of childhood trouble that you've been through, it's somewhere going to be there till the time it's not treated, till the time you've not, as you grow, हम शायद भूल जाते हैं, या we forget because our life is any which way so difficult and you have so much hurdles to cross, but that doesn't mean that internally it's not going to be projected in some way. It can be projected maybe in the future, शायद वो आपके बच्चों पे project हो जाए या खुद पे project हो जाए. It can also be in terms of social anxiety. It can lead to depression. So I guess a professional help is also needed to kind of just check if everything is fine. And even if though you're motivated, which is good, but you need to check your behavior in terms of motivation. Are you pushing yourself to a level जहाँ पे आप बहुत pressure डाल रहे हो to be a certain way in the society? तो वो एक check करना बहुत जरूरी है, and you need to also seek a professional help for that.
So if you feel that there are these issues, so you may need professional help. अब डॉक्टर
Yes,
उत्सव कहते हैं, he changes the topic and he says doctors are busy people. That is right. Dr. Utsav is a physician in North Delhi and very busy practice. He continues motivating everyone in the OPD to follow a healthy lifestyle. The whole
right.
day it's spent in motivation, but sometimes you feel that you are fighting a lost battle because no one seems to listen to you. Actually, मैं भी OPD में कई बार feel करता हूँ. The term that comes to my mind is compassion fatigue. And sometimes I
Yes.
tell my patients, not jokingly, really, I tell them, इससे ज़्यादा इज्जत तो आप पागल कुत्ते को दोगे सड़क पे. If he is barking,
True.
you give more,
True.
you pay more attention to that dog than to me. So I actually say that. So this compassion fatigue comes in, and then added to that, poor healthcare policies, poor infrastructure, financial crunch. Again, patients have to pay from pocket. So
True.
how do you remain motivated yourself when you face so many hardships? So let's take this in two questions, Dr. Sheila. First, a
Yes.
general question: how do doctors and other busy professionals remain motivated? Secondly, what
But
about
yes.
psychologists? All the negativity that you are surrounded by as part of your work, how do you handle that? How do you remain smiling?
So I'll take up your first question. It is very important that first and foremost, self-care. If you don't have self-care for yourself, and you are all the time looking after the other person, that's not what care is all about. जब तक आप खुद का ख्याल नहीं रख सकते, आप दूसरों का भी नहीं रख सकते. So it's very important that you have your me time. It's very important that you take breaks from your work, from your routine. I understand that there are patients that you got to look after, but there are other people also who can do that while you're not there. So self care is very important. And it's the most important rule, that you don't break. बिकॉज आपकी आपके घर में भी कुछ चीजें चल रही है, आपकी लाइफ में कुछ चीजें चल रही है. यू हैव लॉट ऑफ फटीग बिकॉज आई गेस डॉक्टर्स आर वर्किंग, दे मैं तो बोलती हूँ उनके पैरों में व्हील्स लगे हैं, you know so you're on the go all the time. You can halt for a while and take care of yourself too. Coming to your second question, as a psychologist, we do not have any stigma in having our own psychologist too. So, we would go and talk to another professional psychologist if we have a burnout. Yeah, probably we would take a break. There's a lot to do. There's a lot of meditation. There's a lot of breathing exercise. Having me time. I think me time is very important to do what you want to do without judging yourself. I think that's very important. So I guess these are very small things that we keep in check. Having a healthy lifestyle, doing what you love doing, smiling more often, it helps.
Smiling does help actually, and Dr. Utsav has a wonderful smile, I know. So Utsav, I'm sure you're smiling right now. सरताज सिंह जी भी स्माइल कर रहे हैं, ये भी मैं बिल्कुल श्योर हूँ. एंड एक जो चीज है, टेक केयर ऑफ योरसेल्फ. सो मुझे भी आई गेट टायर्ड इन द ओपीडी, and then patients are always in a hurry, and if you take even 2 minutes off, they get angry and they upset and they begin to shout. So I think in polite language, what I've learned from Dr. Sheila today is I'll tell them, let me take care of myself, let me at least have a glass of water, otherwise I will not be able to take proper care of you, so just sit and relax. Dr. Utsav takes the discussion to a specific topic: motivating people to take right modern medicines. So the end result is good health.
Yes,
The surrogate marker of good health is a good blood pressure report, let us say, or a good glucose report, or a good cholesterol report.
true.
Right. The means to that is to follow the right lifestyle and take the right medicine. We
Right,
know that this is the right medicine. Alternative care, we respect alternative care, but there are some alternative schools of medicine where they've never ever checked a glucose or the blood pressure because they didn't have the machines. So I fail to
right,
understand how you can achieve targets when you are not checking. Of course, basic science should be there for everyone, but then the evidence should also be there. You know, you should have the same rigorous clinical trials, and rigorous means rigorous. And
right.
here, what I see is that because the rules are not strict, the word Ayurveda is misused a lot. If you
Yes,
were to go to an Ayurveda Charya, I am very sure you will get very good quality Ayurvedic care. And the Ayurveda Charya will very comfortably and very confidently tell you, this is what I can do for you. For this, you go to Dr. Sheila. And for that, you go to maybe Dr. Utsav. But the word is misused, and you find the word being used left, right, center just for commercial purposes. So now patients fall prey to that. So Dr. Utsav's question is twofold: how do I motivate patients not to follow the the wrong path, and how do I motivate patients to follow the right path?
right. So to an extent, you can go out and go out of your way to help the patients. You can't be doing everything for them. We can't be spoon feeding the patients. I think most of the time we do that because we care for them. But there are a lot of external things that happen in the background too. And the most important thing is most of the patients are coming with Google knowledge these days. It's not just with medico, it's even with the non-medico professionals that I also get a lot of patients saying that this is what how it is supposed to be with only Google knowledge, I guess half knowledge. So in order to uh, you know इसे हम कैसे चेंज करें, आई थिंक साइको एजुकेशन इज वेरी इंपॉर्टेंट. हम साइको एजुकेशन ना सिर्फ पेशेंट को बट केयर गिवर्स उनकी फैमिली मेंबर्स को दिया जाएगा तो it will be very very helpful. I think psycho education is the only key factor that can help.
So psychoeducation, a new dimension coming in. Can we do that as part of OPD practice?
Yes, and it is very important. It's very important that ये सिर्फ डॉक्टर्स तक ही लागू नहीं हो, जहाँ हमारे नर्सेज होते हैं, we have our health boys and everything. Psycho education first has to be internally done to all of these people so that we can give a better infrastructure and better treatment to our patients. And specifically, we should not be forgetting the caregivers. I guess somewhere around the line हम बहुत focus रखते हैं हमारे patients पे, लेकिन caregivers are the main people who goes, I mean, they are gone undiagnosed, you know, and they need major help. So psychoeducation will really help them. Having a lot of patience also, because sometimes we are seeing so many patients, we kind of end to lose our patience also. At the same time, having an understanding that the patient is also coming from certain level of distress. The tolerance is less, the frustration tolerance is less, the core belief is just shattered. I guess psychoeducation will really help large.
We have with us Mr. Sharma, who is a nursing teacher, nursing faculty member in SGPGI Lucknow, and I'm sure he'll be happy to join the discussion. But again, important things coming out from this discussion. एक तो psychological first aid. मैडम ने वर्ड यूज किया साइको एजुकेशन. साइकोलॉजिकल फर्स्ट एड सभी को देनी आनी चाहिए. द वे एवरीबडी शुड नो फर्स्ट एड. आप सड़क पे जा रहे हैं, किसी को चोट लगी, यू शुड बी एबल टू हेल्प विद द बेसिक्स. So what is psychological first aid? Everyone should be able to help, and each and every healthcare professional. And I know that Mr. Sharma is a keen advocate of mental health nursing. So I'm sure they teach that to their students. एक तो साइकोलॉजिकल फर्स्ट एड हो गया सभी के लिए. दूसरा हो गया साइकोलॉजिकल स्ट्रेंथनिंग. सो डॉक्टर उत्सव, माई सेल्फ, डॉक्टर शीला एंड मिस्टर शर्मा, we all try to strengthen ourselves psychologically. We try to create resilience in ourselves so that we can help patients in a better way. And one way of doing this is to think that it is part of your job to be magnanimous. You are so lucky, you are so fortunate that you are in a position where you have read more, where you are more educated. So therefore one should be magnanimous. क्योंकि जो पेशेंट भी आपके पास आ रहा है वो भी डिस्ट्रेस में है. मैं
True.
अपनी गलतियां बताता हूँ डॉक्टर शीला, एंड देखो हाउ यू कैन हेल्प मी. मैं अपनी साइको एजुकेशन कराता हूँ, एंड अली नजाकत जी को भी वेलकम करेंगे. ही हैज जॉइंड अस आफ्टर इफ्तार. सोनी साहब भी हैं, सरताज सिंह जी का भी पॉइंट इसके बाद लेते हैं। तो ओपीडी में कई बार हम फ्रस्ट्रेटेड हो जाते हैं, थक भी जाते हैं, इट इज़ टायरिंग एंड यू हैव 4 or 5 पेशेंट्स हू कम टू यू continuously, in a row, and
Right,
none of them have taken the medicines that you prescribed, none of them did the test that you advised, right? Then they come and complain. तो अंदर से तो आवाज आती है, मैडम जो आपका दिल करता है आप करें, autonomy. It is your choice whether you wish to take alternative care or you wish to take modern care. But if
right,
you're taking alternative care, then you go and complain to the alternative care doctor. Why are you complaining to me? Complaint भी मुझे कर रहे हैं, तंग भी मुझे
right,
कर रहे हैं, दवाई भी मेरी नहीं लेनी. So,
right.
तो how do we sort of how do we maintain equipoise in ourselves? कभी-कभी हम गुस्सा हो जाते हैं और बहुत बार हम sarcastic हो जाते हैं.
Right, right.
So how do
So
how do
before,
we
yeah,
Yeah.
sorry.
Oh, and डॉक्टर उत्सव का एक कमेंट है आपके लिए डॉक्टर शीला. We need to spread your contagious smiles. आपकी smile contagious है. It's infectious.
Thank you, sir.
Okay. So how do we kind of internalize this smile in our clinics? And how do we remain in equipoise?
Right. So first, what we need to understand is before we do any changes in ourselves, first try to understand कि वो patient ने दवाई क्यों नहीं ली है, या is there a factor, is there a reason behind it, you know. um, Trying to first first reaction जो हम instantly देते हैं ना, that can spoil the whole thing. And patients come to us with a lot of hope, and they are like kids, उनको pampering चाहिए, नहीं नहीं ठीक है आप खा लो, ऐसे मत करो, somewhere they need that push. But trying to understand ki, why haven't you done this, why haven't you taken these medications, is there a reason, is there that you don't want to. I think there could be a lot of psychological issues. Most of the people are abusing themselves mentally, that we don't want to do, life is over, ye dawai leke kya hi ho jayega. We don't know. So in order to before we react, trying to understand the factors as to why they haven't done it, trying to know if there is something. And once we know that, I think the reaction should be based accordingly on that. And I'm sure if by the time you react, by the time you hear the answer, your way of reacting to it will be very different. So you get a cool off time also.
So सोनी साहब ने भी एक बहुत बढ़िया स्माइली भेजी है. Thanks सोनी साहब for that smiley. And Utsav also sent a nice smile. So मैडम जो कह रही हैं, this is what we follow in clinical practice. पहले आप हिस्ट्री लेते हैं, सवाल पूछते हैं,
Right,
उसके बाद एक डायग्नोसिस पे पहुंचते हैं कि शायद ये चीज हो, उसके बाद ही आप टेस्ट या दवाई की बात करते हैं. तो अब
right,
जो रीजंस हैं, लेट अस से पेशेंट सेड मैंने इंसुलिन नहीं लेनी या मैंने इंसुलिन नहीं ली. There can be a psychological reason. There can be she's afraid, that is psychological. There can be a
yeah,
social reason. घर पे पैसे नहीं है, फ्रिज नहीं है, हस्बैंड ने मना कर दिया. And there can be
true,
a biological reason. She tried, but उनके जोड़ों में दर्द था तो वो टीका ही नहीं लगा पाई. She was not able to navigate the pen. Yeah, we didn't teach her properly. So
true.
uh, this is one model that I follow in my practice. Let me speak in English and then in Hindi, and madam को पूछते हैं if it works out. I will not take insulin.
Hmm.
मैं टीका नहीं लूंगा. आई शैल नॉट टेक इंसुलिन.
Right,
मैं टीका नहीं लेना चाहता. एंड आई कैन नॉट टेक इंसुलिन. मैं टीका नहीं ले सकता. सो देयर इज अ लॉट ऑफ डिफरेंस बिटवीन विल एंड शैल एंड कैन. नाउ डॉक्टर
yes,
पवार says, सर टॉपिक बदलें इंसुलिन का एंड कम टू ब्रेस्ट फीडिंग. एंड सर का टॉपिक लेते हैं. सो लेट्स डू द सेम थिंग. डॉक्टर
right.
पवार सर को पूछते हैं एंड सीमा जी भी लॉग्ड इन है फ्रॉम कोलकाता. आई विल नॉट ब्रेस्ट फीड माई बेबी. I shall not breastfeed my baby. I cannot breastfeed my baby. Dr. Sheila, would you like to take the conversation further? अब हमारा जो desired behavior है, that is exclusive breastfeeding.
There are a lot of factors why the mother would not want to get into this, because these three things are three different questions. First of all, finding out the reason why the mother is saying all these things. इसका कारण क्या है? Is there a history to it? Is there something that was there in the past that has happened? Is there currently that she's facing something? Or is there a fear of the future about it? Trying to understand all these factors. बहुत सारे पेरेंट्स ब्रेस्ट फीडिंग शायद बहुत सारे कारणों की वजह से भी नहीं करते हैं. सो ट्राइंग टू नो द रीजन behind it. Once we know the reason, being the professional, we can psycho-educate the mother based on those reasons. We can't just हम एक कंक्लूजन पे या हम जज नहीं कर सकते एक माँ को या एनीबॉडी फॉर दैट मैटर दैट नहीं आप क्यों इंसुलिन नहीं ले रहे हो या व्हाई आरंट यू नॉट ब्रेस्ट फीडिंग. फर्स्ट ट्राइंग टू नो द रीजन एंड देन अकॉर्डिंग टू द रीजन वी नीड टू साइको एजुकेट अगेन नॉट जस्ट द पेशेंट, not just the mother, not just an individual, but also the family as to why this person is feeling like this and what needs to be taken care for this person to in order to do the breastfeeding also.
So it might be a psychological issue. मेरे घर में किसी को ब्रेस्ट कैंसर हुआ और उनको डॉक्टर ने ये बोला कि क्योंकि आपके 3 बच्चे थे, आपने सभी को 1-1 साल ब्रेस्ट फीड किया, इसलिए आपको ब्रेस्ट कैंसर हुआ. Now Dr. Pawar knows that that is scientifically not correct. It is actually opposite of what is correct. But how do we know what the patient is thinking? So fear of maybe breast cancer. ये इतना कॉमन नहीं है, बट ये बहुत कॉमन है कि अगर मैं अपने बेबी को फीड करूंगी तो मेरा वेट बढ़ जाएगा, मैं पतली नहीं होऊंगी. So
Right, which is very largely there with that we see. और stigma भी
psychologically,
है.
yeah, social issue हो सकता है. I live in a joint family and there are young brothers-in-law, there are young boys and elderly men, and there is no privacy. I just don't have the privacy. That's a social issue. Another social issue can be, sir, I have to go to work. I've got only 6 days of maternity leave. What can I do? My employer or my employment is such. This is so common in young doctors. Young lady doctors have to leave their children at home and go to work. Even nurses have to do that. So it can be a physical or a social issue. And it might be biomedical also. कि दर्द होती है या nobody taught me how to do it. Yeah, I had a breast abscess. So then you just need, friendly support from the nursing or the pediatrics people. तो वो जो डॉक्टर शीला कह रही हैं कि एक रीजन ढूंढ लें, and for that you will have to take a detailed history. Ma'am, more
Yes.
compliments coming in for you. Dr. N.S. Sharda sir is senior most physician from Ahmedabad. He sends you his blessings and says you are a very
Thank you, sir.
perfect and practical doctor.
Thank you so much, sir.
सीमा जी हैं कोलकाता से. A very strong and a very motivated voice for health awareness. तो her mantra is motivation, moderation and maintenance. So you motivate yourself, change your activities and behaviors in moderation, and that, but you do maintain that behavior जो भी है.
Right. That's absolutely right what मैम is saying because जब हम मोटिवेट किसी चीज के लिए होना चाहते हैं उसके लिए एक हैबिट चेंज की जरूरत है. एंड हैबिट चेंज कब आती है जब आप कंसिस्टेंसी रखते हो.
So I've seen that. Let's say you want to go to the gym, you're tired, या आपको केके मेटॉक्स पे आना है, आपके पास 1 घंटा नहीं है जिम जाने के लिए, कम से कम 10 मिनट के लिए चल जाओ, 20 मिनट के लिए चल जाओ. Even if the consistency is in going to the gym, saying hello to your gym mates and saying कि हाँ यार I am not able to come today because I have such a problem, but I didn't want to break my habit, so I have walked to say hi to you and I'm coming back. That itself will help you a lot.
या बिकॉज यू वॉकिंग आउट टू द जिम तो आपकी वॉक वैसे भी हो जाती है. सो
वैसे भी
यू
हो
ट्राई
गया.
डूइंग समथिंग इज इम्पोर्टेंट टू हैव दैट पुश.
So that is important. And the other thing is that you can have buddies who will help you in motivating you or in ensuring that you actually, uh, walk the talk. So let us say आप जिम भी नहीं जा पाए, पैदल भी नहीं जा पाए, then you have to make up for it, कि चलो रात को मैं सैर पे निकलूंगा या अगले दिन मैं 1 घंटा एक्स्ट्रा जाऊंगा. So there has to be some kind of self audit, and there have to be buddies who will help you in sort of measuring what you are doing.
True. We can always take help from our loved ones, our friends. Like I have started with online workouts. तो मैं अपने सारे पेशेंट्स को बोलती हूँ कि चलो हम ऑनलाइन मिल लेते हैं if you can't do anything. If you can't go. So the moment I come from my works, we all meet online and we are doing some activities online. Breathing कर लेते हैं. We try to do some meditation. We try to do some functional workout. And we made sure that if not every day, then at least thrice in a week, the maintenance of this has to be there. The drive has to be there, knowing कि हमें ये हमारी need है, want नहीं है.
Mhm. डॉक्टर पवार सिंह सर याद कराते हैं कि मैटरनिटी लीव इज फॉर 6 months. Sir, that is true in the government sector and it is true in the formal private sector, but it is not true in the informal private sector. And I think 99% of all Indian working women are in the informal private sector. So let us say you are a lady who goes to the farm, who is doing farming, or you are working in the informal sector here in Haryana or anywhere in the country, you have to go back to work. 6 months की छुट्टी नहीं मिलती sir.
True.
I am reminded actually of my college and pediatrics department थी हमारी. So I'll give this true story because Dr. Pawar is a pediatrician. तो हमारे senior resident थे. He went in the morning to the head of department and he said, "Ma'am, ये मिठाई का डिब्बा आपके लिए." And rounds वगैरह कराए and then he was about to leave the room and she called him back. "Why have you put this box of sweets here?" So he says, "Ma'am, I got married last night." So, okay, congratulations and leave. Then again he was about to go out. She calls him back. "But young man, you were on duty last night. How could you have got married?" "Ma'am, apologies, I took 2 hours off." Sir, ये true story है, Dr. Pawar sir. This is from Christian Medical College, Ludhiana. Maybe about 30, 35 years ago. "I took off for 2 hours without informing you. The other senior resident covered for me. I went and got married and came back, ma'am. Ma'am, I'm sorry I was not able to inform you yesterday." So this is how it has been in the past. And now Dr. Pawar will smile and say, हाँ, हमारे साथ भी ऐसे ही हुआ था.
Right.
Yeah. But we've been talking about motivation today. जो questions है diabetes पे या diarrhea पे, सबको कहेंगे we acknowledge them, but please allow us to focus on this topic today. Dr. Vipin Bandula, who is a civil surgeon, he shares a very good practice. He says that cancer survivors, tuberculosis survivors can help motivate other patients for their treatment. So this thing of buddy system, having friends, Alcoholics Anonymous, uh,
Yes.
peer support, how does this work in practice, Dr. Sheila?
It works very largely. So when we say that, if suppose, for example, a cancer patient who is recovering or recovered is trying to help another person who is going through the same, uh, it not only helps the other person in being in that position, but it also helps you the self also. आपको खुद को भी वो help करता है to be motivated that my God, I've come a long journey. I have done it. And it keeps a drive to keep going. And then, because our body changes a lot with so much of severe illness, terminal illness, your body changes, your mind changes, the way you feel changes, your physical aspect changes. In order to be motivated, if you motivate others, you are motivated yourself.
Hmm.
So it's always no practice what you preach. So if you are telling someone to do something, are you practicing it yourself? Is that's very important.
And a virtuous cycle actually gets created, a virtuous cycle of health and motivation. And we all need it. अब जैसे मैं मैडम से बात कर रहा हूँ KK Med Talks में, तो I am motivated to work more. I am motivated to read more about motivation. And मैं बात करते करते डॉक्टर उत्सव के questions सुनते सुनते I was remembering all the maybe suboptimal or wrong responses that I sometimes use in my clinic. So now from tomorrow, I'm going to be more magnanimous. And गर्मियों में मुझे जो दिक्कत आती है, I get tired, I get voice fatigue. So I'll drink a glass of water every 1 or 2 hours. I mean, at the most, क्या है, patient को बोलो, आप भी पानी पी लो मेरे साथ. So I'll take 2 bottles
Right.
of water. Yeah. Sharma ji from Lucknow, he says that these types of groups, they help in COVID. Which groups, like the ASHA workers and the health workers, they motivate
Yes.
for breastfeeding. Many times you will find that the doctor is not able to motivate. It's not कि डॉक्टर गलत कह रहे हैं या सही नहीं कह रहे. It's maybe the dialect is not the same. या वो जो लेडी है, हमने अभी बात की कि maternity leave doesn't exist in the farming sector. So she will feel कि ये तो लेडी डॉक्टर ये तो बड़े शहर की रहती है. What does she know about my life? But जो आशा वर्कर है, ये तो मेरे गांव की है. She understands what I'm going through. So
Right.
the motivation, if it comes from a person who shares the same social background, the same dialect, that might help more.
True. True. We need to set realistic goals also, Sanjay sir. जहाँ पे you have realistic expectations from yourself, and not putting unrealistic goals. You need to understand also if you are setting some goals to be motivated, आप उसे खुद पहले achieve करो. Try to achieve it yourself, even if it's for a child. Let the child try to achieve its goal on him or herself first before you try to push them to a level where they are not able to do it. वो सीखेंगे कैसे?
So you nudge, go one step at a time. अब मैं बोलूँ जी, I want to appear in the Mr. India competition and become Mr. India, तो वो तो अब होने से रहा. Dr. Sheila, do you think it's realistic?
It could be realistic if you work on it.
If I work on it, so the point is work on it. So focus on the
Yes,
process. हाँ, तो अब
yes,
देखो डॉक्टर शीला ने ना मुझे मुझे डिमोटिवेट नहीं किया, बट शी इज नजिंग मी. शी सेज प्रोसेस में तो आओ, you know. So then you write down all the things that are necessary to in order to become Mr. India and begin working on them.
right.
So
And why do you, so it's also on why would you want to do that? So, is it a need? Is it a want? What are your reasons behind it? वो भी बहुत important role factor play करता है.
can I live without it? Can I not live without it? Is it for
Yes,
self-esteem, ego? वो जो ego है, is it an internal or intrinsic ego? Actually, मेरी
yes,
soul को तृप्ति नहीं मिलेगी if I don't achieve that. या is it an
right.
external ego? I just want to show off to the boy next door कि देख मैं तेरे से ज़्यादा handsome हूँ. So these
Very
also
true.
things come in. Yeah.
Yes, yes,
डॉक्टर विपिन मंडूला से इसके डी एडिक्शन में भी जो सीमा जी का मंत्र है, मोटिवेशन मॉडरेशन मेंटेनेंस, दैट हेल्प्स अ लॉट. सो इन डी एडिक्शन आल्सो यू गो स्लोली. टू क्वेश्चंस लेट्स टेक बिफोर वी कंक्लूड डॉक्टर शीला.
yes,
एक तो सीमा जी पूछ रही हैं कि आई एम अ होम मेकर, मैडम इज फ्रॉम कैलकाटा, trying to motivate homemakers through my efforts and videos. I
right,
feel, Seema ji feels that if a homemaker is well trained in the right nutrition, in the right psychology, psychological first aid, she will be healthy, her family will be healthy, and then the
right,
entire world becomes healthy. There will be less illness,
right,
there will be more happiness in the world. So,
right.
from your perspective, from a mental health professional's perspective, can you suggest something for her? What should she do in her videos, and how should she redouble her efforts to achieve this aim?
Right. So, Seema ji, first of all, thank you for the question. I think what Seema ji should include is, self-care. A lot of homemakers need a lot of self-care because they are on the go all the time, continuously, non-stop, taking out time for themselves also. Um, Breathing, exercise, meditation is very largely neglected. If she can start giving some talks on or making some influential videos on these basic things, how to do self care, also self talk. When we talk about self care, self talk क्या है, हम अपने आप से खुद से क्या कहते हैं, वो भी बहुत important है. If she can make all these basic videos on these basic topics, it would be really helpful and it will reach out.
Thank you, and I know Seema ji well because we've been together on KK Talks for 2 years now. In May, we'll be completing 2 years next month. We
Amazing.
remember Dr. KK Agarwal sir. ये सर की legacy है जो हम continue कर रहे हैं. So I'm
Right.
sure Seema ji will be back in a couple of weeks and she'll be able to tell you कि मैंने ये चीजें की and inspired by you.
I will be
एक
looking forward to it.
एक क्वेश्चन डॉक्टर साहू से लेते हैं.
Yeah.
देयर आर मेनी पेशेंट्स हु हैव विद सोमैटोफॉर्म डिसऑर्डर.
Yes.
सोमैटोफॉर्म डिसऑर्डर का मतलब कि एक्चुअली बॉडी में कोई दिक्कत नहीं है, बट पेशेंट को लगता है कि मेरी बॉडी में ये सिम्टम्स हैं. तो इट इज फ्रस्ट्रेटिंग फॉर अस. वी डोंट, डॉक्टर उत्सव एंड आई दोनों की तरफ से बात करता हूँ, यू डोंट वांट टू ऑर्डर अननेसेसरी इन्वेस्टिगेशंस, you don't want to give unnecessary medications, you don't want to waste the
Right.
patient's money, but patient motivate नहीं होता, convince नहीं होता.
Yes. Yes.
Then they fall prey to lots of quacks, and because they are gullible, they need someone to give them an ear. So how do we
Yes.
motivate them? How do we convince them?
So firstly, यहाँ पे when we are talking about somatoform, it's also again a disorder. We need to understand where is this coming from. It is basically psychological issues. They can be referred to a psychiatrist or a psychologist for the same. And then, of course, psychoeducating them that they need help in regards to this. A lot of somatoform distress comes from childhood trauma or any sort of trauma that you've dealt with in your life. It could be any sort of abuse, it could be any sort of distress. So we need to understand the underlying issue of this problem, and they can be referred to another professional for help, and it can be very largely taken care of. Psychoeducation again is the key factor over here.
is also a good idea to acknowledge the patient symptoms. So अगर आप प्योर हिंदी में, इंग्लिश में, पंजाबी में, मराठी में बोलते हैं, yes, I understand whatever symptom you are saying, I know how it
Very
feels,
true.
and then you
Yes,
move on.
yes.
आपको पेट में दर्द
एक्नॉलेजिंग संजय सर, हम किसी के थॉट्स को या किसी के बिलीफ को चैलेंज नहीं करने चाहिए हमें. आई थिंक जस्ट एक्नॉलेजिंग द फैक्ट, ओके, इफ यू आर गोइंग थ्रू दिस, आई थिंक दिस इज वेयर यू नीड टू गो फॉर हेल्प, एंड साइको एजुकेटिंग देम आल्सो विल रियली हेल्प.
in my OPD, many times I get irritated. There are some patients who don't need treatment, and yet they keep on badgering you. "Dawai likho." So you don't feel good because you are going against science. And then there are other people who need treatment for diabetes, for obesity, and then they will come and say, "जी हमें अंग्रेजी दवाई कोई सूट नहीं करती." तो पहले I used to pick up a fight, get angry. Then I stopped picking up a fight, but I would get angry from inside. Now I've stopped that as well. So now the answer is yes. These are the things that are available. So I can offer you injections. I can offer you tablets, capsules, powders, surgery, whatever there is to offer for that particular thing. And why don't you think over it and come back whenever you are ready?
True. Sometimes placebos also make a lot of difference.
Yes, they do. Seema ji batati hain that she is a graduate in agriculture and a postgraduate in nutrition. So thank you, madam, for joining us. And one of
Amazing.
her reels on how to cook dal to avoid accumulation of calcium in the kidneys, that has got over 1 million views. That is a lot of views.
Nice.
डॉक्टर विपिन पॉइंट्स आउट कि कंडोलेंस मीटिंग आफ्टर डेथ, जो मीटिंग्स होती हैं हमारे कल्चर में आफ्टर डेथ, दैट इज अ टाइप ऑफ साइकोलॉजिकल फर्स्ट एड, एंड दैट्स ट्रू.
Yes.
लास्ट कमेंट लेंगे स्वप्ना जैन जी का. शी सेज यू नीड अ लॉट ऑफ पेशेंस टू मोटिवेट अदर्स. सो व्हेन यू आर बिल्डिंग योर ओन रेजिलियंस, दिस इज फॉर ऑल ऑफ अस इंक्लूडिंग मी, सबसे ज्यादा मेरे लिए, यू हैव टू लर्न हाउ टू बी पेशेंट. And
Right.
I have to motivate my patients every third day for good health. So which means it is continuous, it is ongoing, kabhi khatam nahi hoga. And I understand that it is age factor, and then so many other things are there. So chalta hai, it is part and parcel of life. It
Yes.
is Dr. Sheila, it's been great being with you. And Sapna Jain ji ne bhi point out kar diya कि this should not be our last discussion on motivation. We should continue the
Yes.
topic. Yeah.
Yes. Definitely.
People logged in from across India, from Afghanistan as well. Is there anything you'd like to say to everyone before we log off today?
I would just want to say that don't push yourself too hard. हो सकता है कि कभी कुछ ऊपर नीचे उतार चढ़ाव होते ही है. Just try to change your habits. Be consistent. अगर कुछ भी ऐसे लगता है that you're not able to do it and there is certain level of issues or a problem, please take professional help. मैं तो बहुत ही ज़्यादा कहती हूँ कि mental health के लिए कभी भी stigma नहीं रखो. Please speak to a professional, even if it's for motivation. If you feel you're not being motivated for more than 2 weeks, it means that there could be some problem, there could be some issues. Please seek help, and we are all here to help you guys.
Right. So thank you. We have with us Batul backstage tonight. Batul, could you please show a certificate of appreciation for Dr. Sheila Dang, please?
Thank you.
Thank you. And Dr. Utsav says we do tell our patients to meet mental health professionals, but there is a lot of stigma. So maybe we can talk about that later in another KK Med Talk show, how to
Yes.
minimize the stigma related to seeking healthcare.
Yes.
So with Dr. Sheila, thanks from all of us. Shukriya, Dhanyavad, Meherbani.
Thank you so much, Sanjay sir, for having me again here. Looking forward to be here again.
Thank you. And in Haryanvi, we don't have a word for thank you. So the closest is Thara Bhala Ho. Aapka bhala ho. All good come to you. KK Metalk is there with you every Monday, every day actually, and I am there with you every Monday and Thursday. आजकल हर fortnight पे, every second Thursday, we have a session called Pharma Talks, where we get a leader from the pharmaceutical or biotechnology industry to speak with us. So this Thursday, we'll be having Miss Farida Hussain to talk to us. She's one of the leading doyens of Indian pharmaceutical industry. She'll be talking to us about her perspective. Everybody speaks about the rights of patients and the responsibilities of doctors. So she's not a doctor. She'll be speaking about the responsibilities of the general public. How do we get together to make India a happier and healthier place? तब तक मोटिवेटेड रहें. डॉक्टर शीला से जो हमने सीखा है उसको प्रैक्टिस में लाएं. सो मोटिवेशन एंड मेंटेनेंस बोथ. आप सबसे इजाजत लेंगे. जय हिंद.
Thank you. Bye bye.